Welcome back to the Fox 17 Morning Mix. Despite improvements in maternal and infant health, racial disparities still exist when it comes to successful birth outcomes and maternal health among African American and Latinx populations in Kent County. But thanks to Spectrum Health and community partners like Strong Beginnings, they've been working to change those stats and help level the playing field by ensuring that soon-to-be moms and dads get the essential care they need. Here to talk with us about this effort, Peggy Vandermeulen, Strong Beginnings Program Director. Thanks for joining us, Peggy. How are you?
Good, doing fine. Thanks for having me.
Absolutely. Tell us a little bit more about Strong Beginnings and how this all got started and what services you offer.
Sure. So Strong Beginnings began around 2001 as a small group of volunteers working with the Healthy Kent Infant Health Action Team to address the disparity in infant mortality between Blacks and whites here in Kent County. And then in 2003, when the news came out that Grand Rapids had the highest Black infant mortality of any city in Michigan, that infant health team decided to apply for federal Healthy Start funding, which we received in 2004. And Strong Beginnings became a formal partnership of 7 community agencies with Spectrum Health as the fiduciary. As we received new grants, we were able to expand services to all of Kent County and to include Latinx and certain refugee populations. So our partners are Cherry Health, Arbor Circle, Kent County Health Department, Mercy Health, Michigan State University, Spectrum Health as the fiduciary, and the Healthy Kent Infant Health Action Team that serves as our community level network to address social determinants of health and to improve overall systems of care. The services we offer are primarily through community health workers who work with teams of nurses and social workers from the maternal infant health program. And they serve as peer mentors. They offer home visits to provide social support, education, make referrals to needed resources such as housing, employment, education, or medical care. And male community health workers provide similar services to the male partners, fathers, or father figures.
Love it.
Our therapists provide counseling for clients who are dealing with mental health or substance use disorders or issues. We have a parallel program called Baby Scholars that helps to enhance parenting skills and promote early child development. In addition, we provide extensive community education, breastfeeding support, and we have a strong focus on racial equity efforts because we believe that racism, both systemic and individual, is the underlying cause for the disparities that we see in health status and birth outcomes.
Well, it's a wide...
Finally, thanks to another grant, we're able to offer clinical services to address the disparities that we see in maternal mortality and morbidity.
Peggy, thank you so much. That sounds like a wide array of partners doing an awful lot of good in the area. Talk about the families that you serve, and maybe can you give us an example of maybe some successful outcomes that you've had?
Sure. So we serve women and their partners during pregnancy and then for 18 months after delivery. Last year in 2021, we served a bit over 1,200 families, around 60% African American, 30% Latinx, and 10% other. Many of our clients are facing many challenges. Many have been historically marginalized and oppressed. So dealing with houselessness, abuse, clinical depression, multiple health issues, and so on. And yet when you see the resilience and the dedication that they have to improving their lives, the lives of their families and children, it's just phenomenal to see. And so despite these challenges that our clients face, we've seen significant decreases in preterm birth, which is the main cause of Black infant mortality. We've seen dramatic improvements in breastfeeding and accessing prenatal care, postpartum care, well child care, improvements in mental health. We've also seen lower rates of infant mortality among our clients. You mentioned that there have been significant improvements, which there have been, in Black infant mortality here in Kent County, dropping let me see, in 2004, it was 22.4 infant deaths per 1,000 live births. And now the latest data show that it's 11.8.
Wow.
So that's great to see.
That's like half, Peggy.
And
That's
we
an
can't
amazing.
take credit for that, of course, but we believe that we're part of that.
Yeah.
However, as you also mentioned, there are still racial disparities. And
Yes.
until those disparities are resolved, we still have work to do.
Well, Peggy, let's get people to where they can help you get that work done. Thank you so much for what you're doing and what Strong Beginnings is doing. Let's get people over to these services provided by Spectrum Health through these partnerships. Here you go, Spectrum Health. You can go to strongbeginningskent.org, strongbeginningskent.org, or check out the partnerships at spectrumhealth.org as well. We'll be right back.